Hello, everyone. Thank you for joining us on what is a very um, wet day here on campus. As everyone comes in from the waiting room, I'll start things off today. I am Nicole Presley, she, her. I'm the manager of research and knowledge translation at the Women's Health Research Institute, and lucky to co-host these lunch and learns with our partners at the BC Children's Hospital Research Institute, two of whom are taking very well-deserved vacations today. Um, I'm grateful to be speaking on the ancestral, unceded, and occupied territories of the Coast Salish peoples today, including the Musqueam, Squamish, and Tsleil-Waututh nations. As an uninvited settler on these lands, my relationship to it has been shaped by very harmful and violent colonial histories. I'm grateful to the Indigenous people who have cared for and nurtured these lands, waters, and species since time immemorial. In an increasingly polarized and polarizing digital world, I hold myself accountable to one of the landmark reports, the Missing and Murdered Indigenous Women, Girls, and Two-Spirit Peoples report. And in their calls for justice, I wanted to highlight number 15.5, which is a call upon all Canadians to confront, speak out against racism, sexism, ignorance, homophobia, transphobia, and teach or encourage others to do the same wherever it occurs, in your home, in your workplace, or in social settings. And I just wanted to highlight this because while we are research professionals and facilitators, we all wear many hats, whether you're a parent, a provider to someone, or caregiver. And it's a good reminder, particularly in this day and age where this digital polarization and harm subsequently is very, very pervasive. And so I am really excited to have Haley here today, who is going to talk about weave in some of the equity considerations into a digital health related tool that's probably quite relevant to many of us in our work. So with that, welcome. Haley Foladare, who is our Digital Health Research Manager at the Women's Health Research Institute. She is charged with advancing digital health research within our research community, which spans across the province. Haley's work focuses on ethically grounded, equity-oriented research at the intersection of health, data, and artificial intelligence. She supports and leads studies that critically examine the impact, limitations, and potential of AI and digital tools in healthcare, with the aim of contributing to more inclusive and just health systems. Haley has a background in cognitive systems from UBC and enjoys sailing, kayaking, and trail running. And I have seen her come into the office with a helmet on. I know that she is an active individual who enjoys those two wheels. I'm not sure you'd engage in that today. Um,
Yeah,
but with that, I'll pass the mic over to Haley. Thanks so much for being here.
awesome. Thank you so much, Nicole. I appreciate the thoughtful territory acknowledgement in the land and the introduction. Yeah, so thank you all for joining today. No pressure to have cameras on. I know it's lunchtime and we're all eating, but I really appreciate you taking the time and being here. Yeah, so let's get started. So I would also like to start our conversation by acknowledging that we're uninvited guests on the unceded and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And as research institutes that are committed to improving the health outcomes of women across the Two-Spirit LGBTQIA plus spectrum, I recognize my role and my responsibility in our collective effort towards establishing culturally safe healthcare and culturally safe systems. And when we talk about AI in these contexts, I think it's important that we take a moment to really remember and appreciate that AI is not neutral. AI is influenced by the worldviews of the people who are building it. And as of right now, those worldviews are mainly based in colonialism and capitalism, and they generally exclude Indigenous worldviews and way of knowing. Additionally, for us, AI might feel to you like it's abstract or in the cloud, but the reality is it's built on these very physical systems that have environmental impacts to lands and waterways that Indigenous people have been stewarding since time immemorial. Oops, sorry, I pressed the wrong slide button here. Okay, so for today's session, we're going to talk about assessing risks, applying ethics and bias principles, and using various institutional guidance that's available to ensure value alignment when using AI tools in our work at CW. A bit about me. As Nicole mentioned, I'm the Digital Health Research Manager for the WHRI. My previous role was as a Digital Health Coordinator at BC Children's Research Institute. So, though I'm new in my WHRI role, I've spent a little bit more time in this ecosystem. And so that's a lot of that knowledge that's coming to you today was developed over my role previously as well. And as Nicole mentioned, I really focus on evaluating digital and AI tools and capacity building for researchers in the digital health space. So I'd like to start our conversation today by really emphasizing and inviting us all to recognize that our work across the CW campus is very value-driven and value-based. And if you look at any of our strategic planning documents across both WHRI and BCCHRI, you'll see a lot of value language and a lot of actions that really correspond to those values. So some of those values are equity, partnership, respect for lived experience, and reciprocity. And relationships and trust are really central to the work that we do across both institutes. And AI is entering the picture. So as you are aware, the digital environment and the AI environment around us is changing every day. New technologies are appearing, new versions are coming out, and that's really influencing the landscape that we work in. Previous sessions have touched a little bit on AI usage and the ways that it can aid our work, so I'm not going to go too much into that today. But I do know that it can feel very overwhelming to integrate these new technologies into our lives, especially when we hear a lot about the consequences of misguided AI use. And all of us, by nature of working in this digital ecosystem, have been tasked with decision making around when to use AI and when not to. So I wanted to start by prompting a little bit of reflection for all of us on how this AI decision making is going in our lives. So if you would be so kind as to open up Slido, um, the questions kind of refer to asking you to reflect on areas where you're embracing AI, or areas where you're choosing not to use it, even though it's available. So I will pause for a moment to ask us all to fill that out. Please join in the chat if the Slido is not working for you. And I can also put the link in there. How are we all doing? Are we opening up Slido? See 8 people typing. That's a good sign. Not really sure I'm allowed to use AI. Yeah, I think a lot of us are feeling that way. Some use for time-consuming tasks, editing documents, lots of document grammar, spelling. Some of us are embracing it. Some of us are using it for lots of things at work and at home. This is an interesting point. So this person says they're not intentionally using AI, but it's getting harder to avoid with all of the integrations. And some situations where we're choosing not to use AI, even though it's available. Um, Literature reviews, my personal information, avoiding it at all costs. Totally. Anything with my name on it. I like that. So I'll leave this Slido open as we continue to reflect. Um, Let me get back to my slides here. Oops. So as we can see through our Slido responses and our own reflection, we are all making decisions daily about the ways that we use AI and the moments where we choose to say no. And within our environment at PHSA and UBC, AI is being simultaneously promoted at the same time as it's being cautioned. So we have messaging about encouraging us to embrace AI for its innovative potential, while also a lot of guidance and suggestions about when to not use it and all these things that you need to watch out for. Which really brings us to this moment where we need to navigate the question about how we ensure that our AI use aligns with the values that guide our work at CW. And one step towards answering this question is being able to identify when AI is misaligned with our values. And one way to do that is through the use of ethical frameworks. So this framework that I'm sharing here, the Pan-Canadian AI for Health Principles, this has been endorsed by PHSA. And it's geared towards healthcare in Canada. A few key principles to note, starting with Indigenous-led governance and data sovereignty. So really focusing on the idea that all AI use needs to respect Indigenous peoples' right to self-governance and self-determination. Another principle that stands out to me is person centricity. And this is really around ensuring that the well being of people and populations across Canada is central to our AI use and our decision making around AI. Another interesting one that I want to point out is AI literacy down over here. This is not so much about the use of AI itself, but really about making sure that the communities that we're using AI within have enough knowledge and understanding of the way that AI works so that they're able to provide informed consent to the use of AI in their healthcare. So that's really around educating, providing resources, and really investing time into making sure that they have the information they need to be a conscious user of AI. And so you might be wondering, okay, these are great. How do I actually use them in my daily work? And the way that I like to think about it is that ethical frameworks like the Pan-Canadian AI for Health Principles can really help frame the questions that we ask about our own work. So this can help us ask questions such as, who will be affected by this AI tool, directly or indirectly? Are we at risk of reinforcing health inequities? Is participant data adequately protected? Do patients or other end users have enough information to give informed consent around this tool? And when we ask these questions, it can help us identify for ourselves if the given use of AI is in line with our values or if we need to steer it in a different direction. So the Pan-Canadian AI for Health principles offer a really helpful high-level ethical framework for AI use, but it's also important that we're able to identify where bias might be present in AI systems and explore strategies to mitigate this. So the way that we define bias in an AI system is quite similar to the way that we talk about bias in other contexts, except it's the algorithm that's making that bias decision instead of the human generally. And really, it's around systemic and equitable treatment of different groups by algorithms or AI systems. And I wanted to highlight an example of what it can look like when there's bias present in an AI system. So one scoping analysis done by Abdullah Ahmad and their team They found that women presenting with symptoms of a heart attack are far more likely than men to be misdiagnosed with diagnostic algorithms. And the reason they think this is the case is because these diagnostic algorithms were primarily trained on data that had a lot more data from men rather than women. So the model didn't have the opportunity to learn about what heart attacks look like in women. And therefore, the model can't accurately recognize or diagnose those cases. And depending on the way that these diagnostic algorithms are embedded in clinical care, this has the potential to have direct impacts on the care that women are receiving. So, bias can enter AI systems in a few different ways. And I wanted to kind of break down some of those ways to start our conversation and our reflection about that. One of the ways that bias can enter an AI system is through empathy bias. And this really has to do with the challenge of incorporating this nuanced human experience into these AI systems. So AI is primarily trained on quantitative data. And so we miss out on a lot of the more qualitative aspects of our experience that are generally captured in like an interview or a story based collection. And this can lead to systems that they might not consider patient preferences or values or unique circumstances. And we might get recommendations that are misaligned with patient needs. And if we want to start trying to mitigate this bias, we need to focus on incorporating patients and end users in the design of our AI systems. And while it's challenging, there are emerging ways to incorporate qualitative data from interviews and patient narratives. So very interesting line of work, and I'm excited to see more of that come up. Another way bias can enter AI systems is through environment bias. And this is resulting from social environmental contexts where data is collected and used. So things like social determinants of health, if you live in a city with a lot of access to resources or an urban or rural environment with less, and even other environmental variables such as the way that you're impacted by the effects of climate change. And really looking at mitigating this type of bias focuses on integrating social determinants of health into our models and adapting our models to local contexts when necessary. So sometimes we have one model that we're trying to apply to a big population with a lot of variation. Maybe at times it's more appropriate to separate that one model into two separate models so that it can be better tailored to those populations. And the last type of bias that I'll talk about today is evidence bias. This is really around the process by which scientific evidence is generated and published. So as we know, there's a lot of different factors that influence the type of work that gets published and where that published work is available. And because AI models, many of them, are training on publicly available work, this bias then becomes incorporated into these AI systems. So sources of this bias could be that funding priorities might not be aligned with the needs of populations. And as we've talked about recently at the WHRI symposium, we have a bias towards publishing positive results. So AI is only seeing those positive scientific results. It's not seeing any of the negative or any of that larger process. And additionally, so the presence of paywalls and how work is embedded within that system means that AIs have access to different information. So if we want to look at mitigating this evidence bias, there's a few things we can do as a scientific community. First of all, we want to focus on diversifying our funding priorities. And we also want to encourage transparent reporting of findings, including negative results, to build a more well-distributed knowledge base for AI systems to draw on. So bias can enter the systems through a variety of ways and at a variety of points. And what's important to remember and acknowledge is that AI systems can amplify that bias. So that means that as the model is integrated into a care setting or further used, what started out as maybe a small gap in data can lead to an amplification of inequity. So the heart attack example that we discussed previously is a good example of this. So they started with some inequity in representation in their data, which some people may at moments overlook and say, well, that's kind of the way that data is. But the reality is that that small inequity went on to have a really big impact in patient care. So it's important to acknowledge when we're working with AI systems, even things that we think are small at the start, have the potential to really impact the landscape later on as that system is developed and used. So we've talked a lot about what it can look like when AI isn't value aligned, whether that's because it doesn't line up with our ethical principles or because there's bias in the algorithm itself. Um, and this brings with it many risks. A few that I want to emphasize are that we risk enforcing existing inequities. We may misrepresent lived experiences, and we also could weaken trust in the research process if our research unintentionally perpetuates harm. Additionally, we may accidentally exclude certain groups from receiving the benefit of research. But alongside the awareness of those risks, and even with those risks in mind, we also see the potential for AI to support our work in meaningful ways if it's used safely and responsibly. And it can feel very uncomfortable to hold those things, both of those things at once. So you might be in a position where you're curious about exploring a new AI tool and seeing how it could aid you in your work. But you also know that a lot of things can go wrong. You're aware of the potentials for bias, the potential for inequity, um, and it can be challenging to navigate that space. But around us every day, I see the CW community continue to make really thoughtful decisions about embracing AI's potential. I know that staff, especially in the project management community of practice, are looking at ways to embrace Copilot to aid in project management documentation. I know of some researchers that are working on predictive modeling for patient outcomes, and even some team members that are looking at exploring ways to safely introduce AI-assisted patient monitoring into the NICU. And as staff and as researchers, and we continue to explore this space, new gaps are going to come up. We're going to have new questions. We're going to need some more guidance. And so our need for guidance from our supporting institutes will naturally emerge. Sorry, wrong button here. There we go. And so one of these guidance needs that's emerged recently is the need for some guidance around using AI to translate documents. And so in response to this, WHRI and BCCHRI are collaborating to work to provide some guidance around the use of AI to translate research documents. And when we talk about this framework, we're really talking about an AI plus a human in the loop. So we'll have AI take a first pass, and then we'll have a community member who speaks that language do a review of the document, mainly to ensure accuracy, but alongside that, we really want to focus on ensuring that the document is culturally representative and inclusive of the gender identities of the people that the document will be used by. So if this sounds like something that could apply to your team, if this is something your team is looking at or you're curious about it, we invite you to get in touch with us. We'd love to have this conversation. This pilot will kind of be happening through the participation of various research teams. So we're really inviting some community involvement here. So, alongside efforts from CW, both PHSA and UBC are working to provide guidance to us both as staff and as researchers on navigating the AI space. It's important to remember that as AI is quickly changing, our guidance is changing right along with it, which means that it's important that make sure you're looking at the most recent version of any guidance that you're looking into. And I also know that our position within having multiple affiliations, UBC, PHSA, ASFU, all of the above, can make it challenging to know where to turn at times. And while this is something we're all learning to navigate together, What I'll say is that generally the high level ethical guidance or the usage principles won't vary too much. There's been a lot of consensus in the community about responsible AI use. Where you might find some variation is in specific tool recommendations. So, which program, which AI tool should I be using to do this thing? So, what is actually approved? For our PHSA staff, folks on the PHSA side of things, Copilot is the only approved Gen AI tool that you should be using for work within PHSA. And they emphasize that they want you to be in the PHSA tenant of Copilot. And when we say tenant, we mean the PHSA protected environment or protected bubble, where PHSA and Microsoft have come to agreements about the way that that data will be used. UBC also recommends the use of Copilot, and they have a Copilot tenant, but they use slightly more flexible language about incorporating other tools into your work as well. And again, it's important that you are working within your organization's tenant when using that tool. So you're looking for that green shield with the check mark, and that's how you know that you're in there. And we do have opportunities to incorporate other AI tools as part of REB approved research. So different from our work as staff members or supporting research, we have opportunities to include other tools as part of protocols and studies. And we'll talk in a few slides about how we can start that conversation with the REB. So a bit more on PHSA guidance. And before I get into this section, all these documents are linked on the Lunch and Learn website. So I know you might be eating, but if you happen to have free hands, I invite you to open up the Lunch and Learn website and click through these as I talk about them, just so you have a little bit more recognition and face-to-face time with each one. So I'll start with my favorite guidance document, which is the PHSA AI Research Toolkit. And this was developed here at CW, primarily by Beth Payne, for those of you who know her when she was in her role here. And this is a very comprehensive document geared towards people who are doing research either on AI or with AI tools. So this can be building an AI system, or it can be using AI systems in other ways in your research. And what this document does is it breaks down the AI lifecycle into different sections, and it provides actionable considerations to kind of prompt your thinking through each of those lifecycle phases. So if you're early in the design phase, its prompt is to consider if you're including your end users in your design, or is your data fully representative of your population, those types of things. And alongside that guidance, there is a whole resource library in this document. So if you're looking for resources on computational resources, maybe learning a bit more about data governance and how that can impact your work, or more readings on ethics and bias, including some more technical resources on how to evaluate your model for bias. All of that's in there. So it's a really comprehensive document that came out of our community, a great starting point. Another piece of guidance that is research specific within PHSA is the use of generative AI to complete research work guidance. So this guidance really centers around the use of Gen AI tools, which in the PHSA system is Copilot, to do research work that is not part of your REB approved protocol. So this is things like a literature review or editing a manuscript. And this really provides actionable suggestions for how you can make sure that you're doing those things responsibly, and how to integrate Gen AI into your work that way. So the partner document of this in the staff context is the Generative AI and Interim Direction and Guidance at PHSA. So this is really the guidance for how to use Copilot responsibly in your staff work at PHSA. So it talks about awareness around entering proprietary information, transparency with others while you're using those tools, and it really guides your use of Copilot through your staff role at PHSA. The last PHSA resource I'll mention, this is not a document, but a group of people, is the AI and Research Working Group. So this is a group of researchers. We meet, I think, about once a month. It started at CW actually, and is now expanded to PHSA and a little bit into other health authorities. And this group is available if you have questions about integrating AI into your research, or maybe you're kind of in the early phases of planning a research project on AI and you're looking for some conversation, feedback, or guidance. This is a group you can go to and they can help provide some feedback and point you in the right direction. So they're not a decision-making body, but they are a really good resource for guiding you towards the right next step. Moving on to the UBC space. So as UBC is quite a broad organization, their guidance is really broad as well. So they also have a list of principles to guide the use of Gen AI tools. So similar in structure to the Pan-Canadian AI for Health principles we talked about, but much broader and not only centering around healthcare. And UBC seems to be taking the approach of discipline-specific guidance. Right now, they have guidance for teaching and learning and guidance for academic integrity. And from their website, it looks like they are working to expand that. So there is more to come. And another resource that's available is the UBC Library has put together a great set of resources on using generative AI in research. So similar content to the PHSA document on that topic. It's a great website to click through. It has a lot of good information on things to consider if you're doing a literature review, recommends some tools. Yeah, a really good resource for that. The last document I will talk about today, which is relevant to folks on the CW campus, is our REB's AI Research Ethics Application Checklist. So this is a document that you'll submit alongside your REB application. And it's structured as a series of questions that invite you to consider your use of AI in your research to ensure that it's value aligned. And you may look at this document, it's quite a long one. I know for a lot of people it can feel a bit challenging. But I really invite you to just engage in this process of reflection as you complete this document. And it can help both you and the REB be able to identify maybe if there's areas of improvement to make sure that the work is value aligned or anything that needs to be flagged early on in the process. So this document was developed with the input of the AI and Research Working Group. So a lot of folks have put some good ideas into this document, and it's a really great resource that's kind of embedded in the necessary process for doing AI work at CW. So you might be wondering, what if I have a question that's not covered by any of that guidance? Or what if I have a special use case? And yeah, totally, the guidance is here for us, but as we said, the landscape is quickly changing. So of course, things are going to come up and we might need somewhere else to turn. So on the PHSA side of things, if you have a question about the use of AI in your daily work in your staff capacity, the digital health innovation team will be your go-to. So either that's, how do I use Copilot for this? Is this an appropriate use of Copilot? Or it can be, hey, there's this new tool I'd really like to integrate. Can we start the process of getting this a privacy review? And so that can go to the digital health innovation team. For questions in a research context, either by a researcher or a supporting staff, the AI and Research Working Group can provide feedback, and then the REB also is available to have those conversations. And part of my role is really here to help researchers navigate this space. So if you have any questions and you'd like to just run it by someone, I'm happy to help point you in the right direction and see what I can do to help. So please feel free to reach out to me as well. So through our conversations today, we've explored what it can mean to use AI in ways that stay aligned with our values. And you've seen some of the resources that are available to support you and learned a little bit about how you can bring those into conversations and decisions that you're making around AI. And this is an ongoing conversation. What's really important is that moving forward, we stay engaged as a community of AI users. We continue these conversations, we share questions, and we learn from one another so that we can ensure that our use of AI is value aligned and has the most positive impact that it can have while avoiding a lot of the potential misuse cases. So I have one more prompt on Slido for you all. I wanted to ask you to share your thoughts on how we can continue this conversation. and how we can continue to support your learning. And then there's a couple points in there about AI translation as well. So I'm going to leave this Slido open, and then also open it up to questions. Saw there was some stuff going on in the chat, so I will take a moment to read that now. Oh, I might need to open the new Slido poll, don't I? Okay, give me one sec. Okay, new Slido poll is open. Let me expand my Zoom window here. Yes, thank you, Olivia. Awesome. Thank you all for your engagement on the Slido as well. And I will leave that open. And again, I invite you to reach out to me with any comments or questions or further thoughts. Yeah, and I'm happy to answer any questions here as well, either in the chat or feel free to unmute yourself. Or I'll put my email in the chat as well, so folks have that.
Thank you, Haley. This was awesome.
Thanks.
Um, yeah, just people are saying thank you.
Yeah. And Rebecca, to your comment, yeah, we are doing a bit of engagement with some UBC medical students in the coming days. So, yeah, really hoping to continue to resource that community as well. Yes, PHSA AI and research page. Thank you, Heather. A great go-to. Definitely worth a look.
Haley, I know there's kind of an overview of use cases for different AI tools.
Mhm.
I've heard of ones that are better for, knowledge synthesis, although our librarians would probably kill me for saying that because I think there are some major limitations, but some of them are kind of known for doing certain things. Have you heard
Mhm.
much? I just popped it in the chat as well, and then I'll get to the other questions. Have you heard of open evidence? That's the one, Rebecca, to your question. I've heard quite a few students, but as well like emergency medicine physicians using open evidence for, yeah, kind of those like real-time evidence-informed decision making.
Yeah. Yeah, I've seen open evidence and I've played around with it a little bit myself. As we were talking about earlier, we all do our own kind of personal reflection on the way of using AI. And I actually really struggle with using AI tools to kind of generate specific sources like that. So I think open evidence is a really good tool. I would definitely invite, a lot of awareness when using it. I think it's great to kind of help point you in the right direction. But yeah, I would definitely say a good starting point to kind of help generate some thoughts, but definitely use with a lot of awareness. And again, if you have any questions about that, feel free to reach out and I'm happy to talk more about it.
Okay.
Um, Gail has a good point. I want to add
Hmm.
this to onboarding for UBC students. So I think that's a good idea. Yeah, I totally think that's a good idea. Um, I am not sure so much about the onboarding process at BC Children's Research, but um, yeah, I think if that can be integrated, that would be cool. Mel, yes, good point. I will explore that and get back to you. Mel, could you pop your email in the chat? Perfect. Okay. Sarah asks, where do gaps in current legislation impact or inform our choices of use of these tools? That question is a big one. And I think that what I'm seeing I'm not so familiar with the current like legislation in British Columbia. I know that there's a lot of efforts to centralize guidance in those spaces separate from legislation. Um, I think that right now it's the type of thing that organizations are kind of handling case by case. And certainly that is creating a little bit of a disjointed ecosystem. And so I think that the fact that there's gaps certainly has an impact in that there might be a bit of a disjointed guidance system. But yeah, I'm happy to kind of discuss more about that.
Yeah, thanks for the question, Sarah. And what I'm trying to pick up on as well is in terms of informing the choices of these tools, for those of us who are within a PHSA context, knowing that our only approved option within the health authority is Microsoft Copilot, and that's dictated by this enterprise contract that we have for Copilot. So we hear you. We've also heard lots of equity considerations for Microsoft products for Copilot. And so those are, I think, top of mind as these conversations evolve. Haley, are there any questions you wanted to highlight from the Slido? And you're welcome to, I think you can stop
Yeah, let me
screen
go take
sharing
a
if you want.
Okay, yeah, that would be make things a little easier on my end.
Mhm.
Um, let's take a look at this Slido. So I'm seeing a lot of interest in an online resource bank hosted on the website. So yeah, definitely something I can aim to develop. Um, Other questions with how rapidly the tools are evolving, I'm worried about sustainability of any workflows. Yeah. Um, I think this is something that we are all grappling with. And I too am worried about that. And I have yet to really to find a great solution aside from just staying engaged and educated on new tools that are out there. Yeah, so definitely something we can continue to explore. How do we find Copilot? Oh, this is a great one. Um, yes, because finding Copilot is harder than you would think it would be. There is a little add-on in Word in the corner up there that if you're using Word as part of your like PHSA account, that guy is one way to access. You can also go through your browser. I would recommend PHSA has some good resources. I'll see if I can find them and I can link them. Um, but yes, this would be a very good interactive workshop is how do we use Copilot? Oh, some curiosity about effective prompting of AI. That would be, yeah, a really another great conversation for us to have. Awesome. Getting lots of good ideas. And one, how are we going to receive updates from our organizations? From what I've seen, the PHSA comms team includes a lot of AI updates in their newsletters, which I know a lot of us glance over, but they are in there. So I would say from a PHSA side, that is one place to go. And then within WHRI and BCCHRI, I think our comms teams here are also really invested in making sure that any updates are communicated there as well. So, yeah, I would say for now, keeping an eye on those organizational newsletters is a good start. I can talk. So, Sarah mentions BC Bill 9 changes to our FOI and privacy legislation proposed February 26th has implications of access and transparency, something to review. Yes, definitely very relevant. Um, Aaron wants to know about the actual environmental impacts of using AI. And this is something that I've seen a lot of conversation on. Um, from my awareness, training models has big environmental impacts because of energy usage. There is a bit, from what I've seen, at least in the forums that I'm kind of keeping an eye on. We're not quite in an agreement about exactly what this impact is. We don't really know yet, is the unfortunate thing. But I think we have awareness that, energy usage is has big environmental impacts, and so Yeah, definitely something to continue to explore. Mel has shared a link, bookmark for Copilot. That's a great resource, so please go take a look at that.
Yeah, and maybe Haley, if in case the questions, as I say that, another one comes in. Oh, just some resources. Um, the one thing that I wonder if these folks would benefit from knowing is the seminar series revival.
Oh,
Did you want
yeah.
to mention that? Just thinking about spaces and places people can go for this type of dialogue.
Totally. So we are bringing back our digital health seminar series. That will be on the fourth Thursday bi-monthly. So it will start April 30th and then we'll go June from there. Our session in August is specifically focused around AI tools and collaboration. So that will kind of continue this conversation, probably at a little bit more of an in-depth level. So really looking forward to that. But other sessions also include topics around equity, community, and participant engagement. So that's another great space to join us for more of these conversations. And information about that will be communicated to you through those trusty organizational newsletters. But it also lives on the WHRI website, the Digital Health Learning Corners. Let me find that and link that here.
Yeah, thanks, Haley. Yeah, I think anyone who's, BCCHR or WHRI, the events will be promoted in our newsletters. So just make sure that you are subscribed and reading those newsletters.
Thanks, Rebecca, for sharing that article. I hadn't come across that, but that is, yeah, a really good resource.
Yeah, no worries. It's written by an assistant professor of sustainability business management of natural resources at UBC.
Awesome.
It's sort of a darker look at AI, so if you're
Yeah,
curious.
I mean, it's important to embrace all considerations, you know. I think that's a good resource for us. And yeah, maybe can look at exploring that topic further in some digital health seminar series as well, if that's something people are interested in. Awesome. Again, I'm always available for questions, so please feel free to email. My email is on the WHRI website. And yeah, I will make sure that the slides are also posted to that website as well. Yeah, but thank you all so much for joining. Please continue the conversation. Feel free to reach out. But yeah, thank you.
Yeah, thanks everyone for coming. Thank you, Haley, for this update. And we do intend to use that Slido data to actually inform how we communicate, program, capacity build in this space. So thanks so much for your engagement today. And just a note, we'll announce the speaker in the coming weeks, but our next Lunch and Learn session is scheduled for April 15th from 12 to 1. Look forward to seeing you there. Thanks, everyone. Stay dry.